Thank you, Ashley. Here's a head scratcher for you. Millennials seem to be getting sicker than older Gen Xers or baby boomers. That comes from a United Healthcare Health Action Council report.
The findings show millennials use the healthcare system more frequently than older generations. Craig Kurzweil is one of the authors of that study, joining us now. So, first of all, thank you so much for making time for us. This one's a tough one to swallow because I'm a millennial.
Well, thanks for having me. Happy to jump in and answer any questions you might have.
You know, millennials are heading to the ER 76% more frequently than older generations. They're being hospitalized with diabetes at 106% more, and their hypertension is up 55%. How do you explain this surge in millennial health care?
There's a couple of key factors that you find in the study. First of all, the millennial population uses the healthcare system very differently from past generations. And the most obvious indication of that is in utilizing frequent care. So millennials in our book of business use the ER the most, but it's not for lack of other options. They also use the urgent care the most, and they use telehealth and virtual care the most. Where they are different from their past generations also is that they do not typically leverage brick and mortar PCPs. So they like quick sort of urgent care, but they don't adopt the same brick and mortar PCP that the older generations typically had across the healthcare system. That combined with the fact that the millennials are now turning 40, right? The millennials are from 27 to 42. So many of our millennials are now turning 40 and getting everything that kind of comes with that from a disease perspective. You have a population that engages the healthcare system in a very different way, but also is now developing chronic disease. And that leads to some of the trends that we're seeing in the study.
Does this surge put a burden on the healthcare system, or can it handle it?
I think definitely it changes the focus of the healthcare system. So we need to meet these numbers where they are. The millennials are now the dominant workforce across America in almost all industries that we look at. And the healthcare system in totality was created basically to support the baby boomer generation. But what we're seeing is the millennials are incredibly different. And so now that they are the dominant workforce, we all need to adjust. We need to meet them where they're at. So we know that millennials now have chronic disease. They're no longer young and invincible. They have chronic disease. So we need to make sure we can meet them where they're at. And if that they adopt, virtual care, for example, in high rates, we need to make sure that virtual care changes from just being managing cough and cold to now managing diabetes and chronic disease, because that's the issues that this generation is now starting to face.
So I love when we talk about issues like this, I love to try to ask, what's causing this? What are the implications? Because is it like an access thing? Is it like, what do you think, or what have you found to be causing these what we're seeing?
I think it's just a general issue, not just impacting the healthcare system, but all industries and how millennials like to receive goods and services. So in general, think of the Uber generation, right? The ability to get your care when you want, get your goods and services when you want and how you want it is very different than how the healthcare system was set up. And so as a millennial looks to receive healthcare, they don't want to wait a couple hours in a waiting room or a couple of months for a PCP visit. They want to get care when they want it, and they want it in the time frame that matters to them. So I don't think it's necessarily specific to healthcare. I think it's a general sort of pattern of utilization across all of the industries for that generation. It's just healthcare is now being impacted more broadly.
Are there any solutions? Like, what can be done?
The biggest piece is to meet them where they are, right? We could continue to kind of bang our head against the wall and assume that we should force fit a primary care, a normal brick and mortar primary care relationship with the millennial generation. We can continue to do that. And analytically, I could tell you all the great attributes that come with seeing a primary care doctor on a regular basis. But if that's not how the millennials are going to access care, we need to change. We need to adopt it. We need to adopt mostly technology to change that virtual telehealth experience into something that can manage chronic disease and support this generation.
This is so interesting. I really think that it's giving a lot of people quite a bit to think about. Craig Kurzweil, thank you so much for rocking with us today and making us aware of the situation and its potential implications on healthcare.
Thanks for having me.